Hi, Mr. Jones. It looks like you came in for some concerns about your blood pressure today and that it's been high for quite some time. There are three different types of hypertension or high blood pressure that we're looking at today. The American Heart Association considers any type of consistent high blood pressure to be concerning because that means the heart and the blood vessels have an increase on their workload, and that will cause them not to only work harder but less efficiently as well. The first type of high blood pressure is called primary hypertension or essential hypertension. This is caused by no known second-hand factors that could attribute to the causes of your high blood pressure. The other type of high blood pressure is known as secondary hypertension, and this is caused by something potentially going on in your body, or it can be caused by medication, according to the latest studies in pathophysiology. Luckily, this type of high blood pressure can be remedied by identifying what's causing it, as long as it's caught and treated early enough. Complicated hypertension is when we start seeing damage to the heart and vessels, and other organs are going to be affected as well, such as the kidneys, the brain, the heart, and the eyes. Complicated hypertension can also lead to stroke, heart attack, kidney disease, vision loss, heart failure, and sexual dysfunction. Because you've had high hypertension for quite some time, most likely it's not secondary hypertension, so we'll need to look at other factors today. There are a few factors that you can simply not do anything about, and those are things like your age and your race, as well as your familial history. But there's also factors that you can help to change within your own by yourself, and in order to help reduce your blood pressure. And medications can be added as well. The American College of Cardiology really recommends lifestyle changes to help reduce the blood pressure. It looks like right now you're drinking several beers every night and you don't really pay much attention to your dietary intake. And it looks like you've gained some weight over the past year as well. And these can be factors that are causing you to have some of that shortness of breath, and can also be causing you to have some of that high blood pressure as well, because it causes your heart to work harder, which is going to inadvertently cause your lungs to work harder as well. I recommend starting to watch out more of what you eat, including eating more fruits and vegetables, less carbohydrates, and more whole grain, and concentrate on cutting back on the beer that you're drinking as well. Adding in a little exercise is going to help lower your blood pressure and hopefully help keep those levels down too. We can look into adding a medication to help lower the blood pressure as well, because like I said before, you do have those factors that you're not able to control, like your family history, your age, and your race. But if you don't change some of the factors that you can change, the drinking, the eating, the non-exercising, the hypertension can go to what's called that complicated hypertension that I mentioned to you earlier. And that leads to, not only the muscles in your blood system, your heart being weaker, and it really increases your chances of such things happening to your heart, such as congestive heart failure. And that's when the heart muscles become a little bit weaker. One of the walls gets thicker, but it's not getting thicker with a muscle, so it's not pumping as efficiently, and it causes the heart just not to be able to pump blood through. Congestive heart failure can lead to you actually needing to be on oxygen as well all the time, because you're not able to oxygenate your body properly, and you're not able to maintain that level, which is going to obviously make exercise a lot harder. You're not going to be able to work as easily. So we don't want it to progress to that point. So let's get started with some of those lifestyle changes that we talked about. Watching your diet, concentrating on less carbohydrates, more whole grains, cutting back on the sodiums, and also working on a little bit more exercise. You really should work on 5 to 6 days a week of 30 minutes of exercise as well. The American Heart Association really recommends that to help make a significant decrease in your blood pressure levels. And also, losing weight can help decrease your blood pressure by as much as a few points, which can add up and make a difference in the end. So let's go ahead and talk about getting you started on some blood pressure medications, and also let's see about you monitoring your blood pressure at home and be able to keep an eye on how well those numbers are changing or not changing, depending on that medication that we choose. And if we have to make changes later down the road, or if we need to add anything on, then we can do that at that time.